Achilles tendon pain presents as pain on the back side of the heel and is common in runners because of the high loads placed on the Achilles tendon. In this video, we'll talk about the pathology of Achilles tendon pain, the different types of Achilles tendon pain, as well as a rehab program that'll get us from the initial injury all the way back to running. Tendinopathy is the medical term used to describe tendon pain, and it's considered an overload condition, meaning that the loads placed on the tendon have exceeded what it can tolerate, leading to the pain. And there's a couple of different ways that this can happen. One way is with an acute spike in load. So this might be somebody who's running a 5K or a 10K with inadequate training, and then when they run, they spike the load, and that leads to an overload. The other option is that it's a chronic overload condition, meaning that somebody is continually running on the Achilles tendon and there's inadequate time in between each session to fully recover for the tendon, and that leads to more of a chronic overload condition. You've also probably heard of it referred to as tendonitis, and that was when we thought that Achilles tendon pain was actually an inflammatory condition. However, we actually see that inflammation plays a pretty small role in the development of Achilles tendon pain, or just tendon pain in general. And so anti-inflammatory treatments like NSAIDs or corticosteroid injections have a limited role in the actual treatment for these types of tendon pain conditions. Additionally, there are two different categories of Achilles tendon pain. So we have an insertional tendinopathy, which means that the pain is where the Achilles tendon attaches onto the heel bone, which is called the calcaneus. And then we also have a mid-portion Achilles tendinopathy, which is where the pain is a couple centimeters above that, which is also the more common type of Achilles tendinopathy. There's not too big of a difference on how we approach mid-portion Achilles tendinopathy versus insertional tendinopathy, but there is some differences. So for example, with insertional tendinopathy, we're a little bit more concerned about compression of the Achilles tendon against the calcaneus bone. And so we might limit dorsiflexion when we're doing some of the exercises for insertional tendinopathy. Additionally, we might be a little bit more strict about limiting the amount of stretching that we're doing for the calves because we just don't want to cause irritation. Additionally, for insertional tendinopathy, they might do better with a heel lift initially, which will help to just give the tendon a little bit of time to calm down. And sometimes there's some misunderstanding when we talk about compressive loads and tendinopathy, specifically for insertional tendinopathies, in that with those compressive loads, when we stretch, that it's going to cause damage to the tendon. However, when we look at the research, it was actually high compressive loads plus high intensity of loading that would lead to changes to the tendon. But when we look at stretching, it's actually high compressive loads but low intensity of loading. So we're not actually going to see those structural changes. So as long as we're not loading a lot in the end range of the position, then we're not too concerned about those compressive loads causing damage. We're actually just avoiding those compressive loads for the sake of it actually being a little bit more comfortable and not irritating the tendon. For rehab, the goal is to gradually increase the tolerance of the Achilles tendon to whatever it is. So in this case, we're looking at the loads that we'll experience with running. And the rehab program generally occurs in three different phases. We have isometric, isotonic, and then plyometric or return to sport. For isometrics, these are typically used for an Achilles tendon that is really sensitive to load. So the most basic version is just to lift the heels up off the ground and then to hold this position. To make this a little bit more dynamic, we can walk on our tippy toes, which will challenge the Achilles tendon a little bit more. Walking backwards increases the load because the calf muscles have to contract to make sure that the body weight doesn't make the heels drop when moving backwards. Typically, these are all performed for 30 to 45 seconds for 3 to 5 repetitions. With the majority of cases, we can actually start with isotonic loading, and the key with isotonic loading is that we want to make sure that we're focusing on time under tension. A lot of times when people perform the calf raises, they perform them a little bit too frequently because of course we all want to get done with our rehab exercises as soon as possible. But the time under tension makes sure that the tendon is able to sense the load and then therefore adapt to it. So ideally these calf raises are performed over 6 to 8 seconds. That's 3 to 4 seconds up during the concentric contraction and then 3 to 4 seconds down during the eccentric contraction. Like we were saying in the beginning, for an insertional tendinopathy, these would be performed on the ground to limit the amount of dorsiflexion initially. However, for mid-portion, they can be performed either on a slant board or on the edge of a step to increase the range of motion that we're performing the calf raises through. The specific reps and sets really depends on the tendon's tolerance to load, plus the amount of weight that we're using. Typically, with the more weight that we use, the less reps that we're going to be able to do. If we're looking at just body weight reps, then typically we'll start around 3 sets of 15 reps and then gradually increase to we're doing some sort of variation of about 100 reps per day. Then finally, when we're looking at returning to running, we want to make sure that the tendon is able to tolerate those quicker loads that it'll experience with running. So we might not be as focused with larger jumps, but doing pogos makes sure that the tendon can tolerate running. Starting with a double leg pogo to begin loading the tendon, but then gradually progressing to a single leg pogo. At first, it might be helpful to start with sets of 10 reps to build up the tolerance, then switching to a time-based approach, performing pogos for maybe 1 to 2 minutes. So hopefully this video on Achilles tendinopathy for runners was helpful. If it was, go ahead and leave in the comments below what race you're currently training for, and then if you want to help out the channel, go ahead and hit the subscribe button as well.